Hi everyone, and Assalamu alaikum. I'm Azrul Arifin, your lecturer today for the subject Medical Sciences DMHS. Today, we will discuss the disease hypertension. We'll define, classify, and explore the etiology, pathophysiology, and clinical manifestations of hypertension. We'll also cover diagnosis, management, complications, and patient education. Blood pressure is the force exerted by circulating blood against the walls of the arteries. It's a vital sign reflecting cardiovascular health. Blood pressure is recorded as two numbers, systolic, the top number, and diastolic, the bottom number. We'll discuss what constitutes a normal reading. Okay, what is blood pressure? Blood pressure is categorized into optimal, high normal, and various stages of hypertension. Understanding these ranges is crucial for accurate diagnosis and intervention. Hypertension is persistently elevated blood pressure, defined as SBP over 140 mmHg or DBP over 90 mmHg. It affects a significant global population and is a leading risk factor for mortality. Essential hypertension or primary hypertension has no identifiable cause and is influenced by factors like genetics, diet, and lifestyle. Malignant hypertension is severe with organ damage. Secondary hypertension arises from underlying conditions such as kidney disease, endocrine disorders, or certain medications. Treatment focuses on correcting the causative agent. Other classifications include isolated systolic hypertension, resistant hypertension, and white coat hypertension, each with distinct characteristics and management considerations. The pathophysiology involves stimulation of the renin-angiotensin-aldosterone system, leading to salt retention and increased blood volume. Arterial narrowing also contributes to elevated pressure. Genetic and environmental factors contribute to defects in sodium homeostasis, vasoconstriction, and vascular structure, ultimately increasing cardiac output and peripheral resistance, leading to hypertension. Hypertension often presents without symptoms. When present, clinical features can be nonspecific, including headache, dizziness, nausea, vertigo, weakness, and palpitations. In severe cases, patients may experience confusion, blurred vision, edema, nocturia, epistaxis, or even coma, indicating significant organ involvement. Diagnostic investigations include urine analysis, blood tests for cholesterol, uric acid and electrolytes, serum creatinine, and a chest X-ray to assess cardiac status. Further investigations may include X-ray cube, ECG, fundoscopy, ESR, cardiac enzymes, liver function tests, and thyroid hormones to identify underlying causes or complications. Differential diagnoses for hypertension include kidney failure, hyperthyroidism, Cushing's syndrome, and brain cancer, requiring careful evaluation to distinguish. Non-pharmacological management involves lifestyle modifications, weight reduction, a low-salt and low-fat diet, reduced alcohol intake, smoking cessation, relaxation, and regular exercise. Pharmacological treatment is tailored to the hypertension stage. Monotherapy is often used for mild cases, while combination therapy is common for moderate to severe hypertension. Common antihypertensive agents include diuretics, ACE inhibitors, and angiotensin receptor blockers, each targeting different mechanisms to lower blood pressure. Additional antihypertensive agents include calcium channel blockers and beta blockers, offering further options for effective blood pressure control. Complications of uncontrolled hypertension are severe, including hypertensive crisis, damage to blood vessels, heart, brain, eyes, and kidneys, potentially leading to organ failure. Patient education is vital. Adherence to medication, regular follow-up, and maintaining a healthy lifestyle, including diet, exercise, and stress management, are crucial. Prognosis is good with early detection, consistent treatment, and healthy living. However, it is poor in cases of hypertensive crisis or complications, which can be fatal. Thank you guys for joining this discussion on hypertension disease. Remember, practice makes perfect. Apply these strategies in your self-study. See you next video. Bye.